Okay, so today we'll talk about the base of the skull.
Base of the skull begins from the incisor teeth all the way back to the external occipital protuberance. Now, talking specifically about the teeth, these are the upper teeth, or they are also called the maxillary teeth because they are attached to the maxilla. Here we've got the central incisor teeth and lateral incisor teeth to the right and to the left. This is the canine tooth, and these are the two premolar teeth, first and second upper premolar teeth, and these are the three molar teeth, first, second, and third upper molar teeth.
This is the heart palate. It's composed of two major parts. This is the palatine process of the maxillary bone or the maxilla, and this is the horizontal plate of the palatine bones. This is the intermaxillary suture, and this is the incisive foramen. It provides passage for the nasopalatine nerve, a terminal branch of the descending palatine artery, and it also provides passage for the palatal branch of the facial artery. This is the palatomaxillary suture, and here in the palatine bones we've got the greater palatine foramina to the right and to the left, and also lesser palatine foramina. We may have one or two lesser palatine foramina on each side. In this case we have two. If you can focus, see, we have two lesser palatine foramina on each side, and the greater palatine foramina is for passage of the greater palatine vessels and nerve, and again the lesser palatine foramina for passage of the lesser palatine vessels and nerve. Posterior part of each palatine bone unite at the posterior nasal spine, which provides attachment for the musculus uvulae. Now anteriorly we have got the anterior nasal spine, and from here it becomes the vomer bone, and from here it becomes the perpendicular plate of the ethmoid. But for the exam, if there's a spot on this, we'd say that this is the vomer bone. Now in this base of the skull, talking about the sphenoid bone, so this is the vomer bone, by the way. This is the vomer, not the sphenoid. Anyway, so the vomer bone divides the nasal cavity into the right and left nasal cavities. Okay, so these are the medial and lateral pterygoid plates of the sphenoid bone. Okay, so this is the palatine. These are the palatine bones. They go like that, again like that. But these are the medial and lateral pterygoid plates of the sphenoid, and this is the vomer bone. Now talking about pterygoid process of the sphenoid, this is the medial pterygoid plate of the sphenoid, provides attachment for the superior constrictor muscle of the pharynx, and this is the lateral pterygoid plate of the sphenoid, providing attachment for the medial and lateral pterygoid muscles. As we said, in the inferior border of the medial pterygoid plate of the sphenoid, anteriorly we've got the projection, which is called the pterygoid humulus, providing attachment for the pterygomandibular ligament and also the tensor vili palatini muscle. This is the pterygoid fossa. Okay, this fossa. This is the pterygoid fossa. It's also called scaphoid fossa, and this also provides attachment for the tensor vili palatini muscle. Now still talking about the sphenoid bone, posterior lateral to the lateral pterygoid plate of the sphenoid, we've got the foramen ovale. This is for passage of the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. We can memorize them better as male.
And then posterior lateral to the foramen ovale, we've got the foramen spinosum, which is for passage of the middle meningeal artery, and also the emissary vein, and also the nervus spinosum, so we can better memorize that as man. Posterior lateral to the lateral pterygoid plate of the sphenoid, we've got the foramen ovale. Posterior lateral to that, we've got the foramen spinosum, and finally posterior lateral to that, we've got the spine of the sphenoid for attachment of the sphenomandibular ligament. Okay, so these are the foramen lacerum on each side. Okay, so they are formed by the sphenoid, occipital, and also temporal bones. They are the most medial foramina in the skull, and they are for passage of the emissary veins. Okay, and then posterior to the spine of the sphenoid, we've got the carotid canals on each side. These are the carotid canals for passage of the internal carotid artery, and then posterior to that, we've got the jugular foramina. Okay, they are much larger, jugular foramina, and they are irregular in shape. So as we said, this is the jugular foramen, providing passage for the sigmoid sinus, which will become the internal jugular vein, and it also provides passage for the inferior petrosal sinus, also providing passage for the cranial nerves 9, 10, and 11. The cranial nerve 9 being the glossopharyngeal nerve, and of course cranial nerve 10 being the vagus nerves, and cranial nerve 11 the accessory nerve. Now talking about the mandibular fossa, okay, so here is the mandibular fossa. It articulates with the head or the condylar process of the mandible to form the TM joint or the temporomandibular joint, which is synovial joint. And then here we've got the external acoustic meatus, or it's also called external auditory meatus. And then we've got the styloid process. Okay, so here is the styloid process, and this is the mastoid process, providing attachment for the sternocleidomastoid muscle. The styloid process provides attachment for the stylomandibular ligament and stylohyoid ligaments, and also three muscles: stylohyoid muscle, styloglossus muscle, and also stylopharyngeus muscle. And between these two, we've got a foramen, which is called the stylomastoid foramen. Now talking about the occipital bone in the base of the skull, this is its basilar part. Okay, basilar part. These are the condylar part and the squamous part. Now in the basilar part, we've got a very important landmark, which is called the pharyngeal tubercle. The atlas bone, which is the first cervical vertebra, articulates with the occipital condyle at the atlanto-occipital joint. And this is the foramen magnum for passage of the medulla oblongata, and also for passage of the spinal part of the accessory nerve. So how does this occur? This is the spinal cord. From the spinal cord, we've got some fibers, which are the spinal part of the accessory nerve. They go upwards to pass through the foramen magnum, and then in the cranium or the cranial cavity, they will fuse with the cranial fibers of the accessory nerve to eventually form the accessory nerve, which is the cranial nerve 11, and then that will pass through the jugular foramen. Okay. And we also don't have to forget that the foramen magnum provides passage for the right and left vertebral arteries. These are the condylar canals for passage of the condylar emissary veins. And here, this is the hypoglossal canal, and again, here, the hypoglossal canal. But these are the jugular foramina. See, they are much larger and irregular in shape, but this is very smaller and circular. This is hypoglossal canal for passage of the hypoglossal nerve. So as we said, this is foramen ovale, foramen spinosum, spine of sphenoid, carotid canal, jugular foramen,
This is jugular fossa and hypoglossal canal.
This is the external occipital protuberance, a projection on the squamous part of the occipital bone, and right on the horizontal line with the external occipital protuberance, we've got the superior nuchal line. This is for attachment of the sternocleidomastoid muscle, trapezius muscle, occipitalis, which is the occipital belly of the occipitofrontalis, and also the splenius capitis muscle. The external occipital protuberance provides attachment for the nuchal ligament and the trapezius muscle. This is the inferior nuchal line, which doesn't provide many attachments. And finally, this is the external occipital crest or median nuchal line for attachment of the nuchal ligaments.